Hello and welcome to my YouTube channel, AnatomyMentor. I'm Dr. Hamd, and today we're going to be discussing the development of the teeth. So this is an important topic for the students of medicine as well as dentistry. And today the embryological discussion will focus on teeth formation, including their precursors, differentiation stages, and related clinical conditions. So before we start with the embryology of the teeth, let's look at the basic structure that the tooth is composed of three types of tissues. Now, these three types of tissues are enamel, dentine, and cementum. You see here is a simple diagram through a sagittal section of a tooth. It is showing us in black over here the enamel, which is covering that part of the tooth which is above the gingiva. This is known as the crown of the tooth, and it is covered by the enamel. Enamel, you should know, is the hardest substance in the human body. And if we look at this part of the tooth, which is the root, that is the part below the gingiva, or the gingiva are the gums, this part, the root, it is covered by the cementum. And then if we look at the bulk of the tooth, it is mainly formed by the dentine. So these are the three basic types of tissue which are forming the tooth: enamel, dentine, and cementum. And keep this in mind that the tooth is present within the bony socket, which is the alveolus. And around the cementum is the very strong periodontal ligament, which has fixed the tooth within the alveolus. And this portion, along with the gingiva, is collectively known as the periodontium. So we can say periodontium constitutes all the supporting structures of our teeth. What you have to know is that although the strongest substance in the human body is enamel, yet it can be damaged by bacteria, acids, and plaque. And once you've lost your enamel, it does not grow back. Enamel is incapable of self-repair because the ameloblasts, that is the cells which are forming your enamel, they are permanently removed once enamel has been formed. Whereas dentine and cementum, they have a limited capacity of self-repair and regeneration. Now let's come to the embryology of teeth, the formation of teeth. What are the three basic tissues which are forming the teeth? Well, the first one is the ectoderm. This gives rise to the ameloblasts, which are the enamel-forming cells. Then come the neural crest cells. They give rise to odontoblasts, which are going to form your dentine, and cementoblasts, which will form your cementum. And neural crest cells also form all the connective tissues of the teeth. Then the third type of embryonic tissue is mesoderm, which gives rise to endothelial cells that form blood vessels. Now, human beings, like many other mammals, are diphyodont. Now, this means that in human beings, two sets of teeth are going to appear, one followed by the other. The first set of teeth that appears is known as the primary dentition, also called the milk or baby teeth or deciduous teeth. And these are 20 in number, which means 10 for the upper jaw, 10 for the lower jaw, and 5 in each quadrant. This is then replaced by another set of teeth, which are the secondary dentition, also known as the permanent or adult teeth. These are total 32 in number, which means 16 in the upper jaw, 16 in the lower jaw, and 8 in every quadrant. Now, coming to tooth development, it is divided into different stages for descriptive purposes. And remember, it involves reciprocal interaction between the oral epithelium and underlying neural crest-induced mesenchyme. And this process of tooth development starts before birth and continues for several years after birth. Now, this is a table which is summarizing the eruption time as well as the shedding time of the deciduous teeth and the permanent teeth. If you look at the deciduous teeth, I told you there are a total of 20, which means 10 in the upper jaw and 10 in the lower jaw. And in each quarter of the jaw, you would have 5, that is the 2 incisors, the canine, and the 2 molars, from anteriorly to posteriorly. And this here you can see the medial incisor will erupt when the baby is about 6 to 8 months old, and it will fall off or it will shed when the child is about 6 to 7 years of age. Then similarly, the time for the lateral incisor eruption is 8 to 10 months, while it sheds off at about 7 to 8 years of age. Similarly are the timings for the canine, the first molar, and the second molar. Generally, you can see it is at 6-month time period when the deciduous teeth start making their appearance, and it is after 6 years onwards that they will start to shed off, and this process continues till 12 years of age. Now let's look at the permanent teeth. As I told you, there are a total of 32, 16 in upper jaw and 16 in lower jaw. So in each quarter, you've got 8, and these are the 2 incisors, 1 canine, 2 premolars, and 3 molars. And they start to appear after 6 years of age. And you can see the third or the last molar, it makes its appearance, can be up to 25 years of age. And so this is the time period till this process continues. Now let's first discuss the formation of the primary dentition, that is the milk or baby teeth. Well, the first indication of tooth development is in the 6th week of intrauterine life, when there is a thickening of oral epithelium to form U-shaped ridges following the curves of the upper and lower jaws. These U-shaped ridges are known as the dental laminae. So here is a sagittal section to the early stages of face formation. This is in the intrauterine life. In diagram A, you can see it is in the 6th week when this thickened oral epithelium has become prominent, and it is known as the dental lamina. So this is the dental lamina for the upper lip and upper jaw, and this is the dental lamina for the lower jaw. And now later in the 6th week, you can see that the tooth buds are going to arise from the dental lamina. This is known as the bud stage of tooth development. So what happens is in the 7th week, from each dental lamina, 10 proliferations known as tooth buds are going to extend into the underlying mesenchyme, which is condensed. So this is your dental lamina, and this here is the proliferation known as the tooth bud, which is arising from your dental lamina. Your dental lamina is the thickened oral epithelium, and this here proliferation, the tooth bud, it is invaginating the underlying mesenchymal tissue, which has become condensed. And now let's look at the further stage of development. What happens to these tooth buds is that they transform into caps. What happens in 8th week of intrauterine life is that each tooth bud is going to be invaginated by mesenchyme to form a hillock-shaped dental papilla, known as the cap stage of tooth development, because the dental lamina is covering the top of the dental papilla like a cap. So let's look at this diagram over here. This was the oral epithelium. This is the tooth bud. We can see it's on its lower aspect, there is an indentation, and this area, this part is now known as the dental papilla. And you can see the morphological appearance of this tooth bud is now in the form of a cap. So this is known as cap stage of tooth development. And the part which is derived directly from the epithelium, that is known as the enamel organ. Dental papilla is the primordium of dentine and dental pulp. So this is an important point to remember, that our dental papilla is going to form the dentine, which is going to form the bulk of your tooth, and the dental pulp. Whereas the enamel organ, which is derived from the ectodermal dental lamina, it has an inner and outer epithelia with a reticulum, a star-shaped stellate reticulum in between. So there's star-shaped cells in stellate reticulum. We're going to look at that. Now, let's also see that what happens in the next stage, which is now known as Bell stage of tooth development. In the Bell stage, which is going to occur in the 10th to 14th weeks of intrauterine life, the mesenchyme surrounding the dental papilla and its dental cap condenses to form an enclosure called the dental follicle or dental sac. This is now known as Bell stage of tooth development because dental lamina is resting over the dental papilla like a bell. So the morphological appearance has now shifted from cap to bell. The connection of the tooth, meanwhile, to the oral epithelium is going to degenerate. So let's look at these stages in the 10th week of development. This was your original dental or oral epithelium from where the tooth bud emerged. And then you can see this here is the enamel organ, which is comprised of outer enamel epithelium, and this here is the inner enamel epithelium. And between these are the star-shaped cells. This is known as the stellate or enamel reticulum. And here is the indentation which contains your dental papilla, okay? And the dental papilla, as I told you, is going to form your dentine and dental pulp. And so this structure collectively, the mesenchyme condenses external to this structure, and it is known as the dental sac or dental follicle. And now it is in the Bell stage of development at 14th week of intrauterine life, because this enamel organ is in the form of a bell, which is more prominent over here. You can see now at 28th week of development when the enamel is being produced, and also the predentine and the dentine are also being produced in the middle of the tooth. And in the very center at the core, you can see this is the dental pulp, and here it contains the blood vessels. Outside enamel organ, you can see this here is there will be the periodontal ligament and your alveolus. Also keep in mind the inner and outer enamel epithelia, they unite at this point over here, which is known as cervical loop. And this is where the epithelial root sheath is going to be formed. Also, I would like you to focus over here on this connection that was between the oral epithelium and this developing tooth. This connection is going to degenerate. Now, what you have to remember is that the first tooth bud which erupts, it makes its appearance in the lower jaw, that is the anterior mandibular region. Later tooth development occurs in the anterior maxillary region, and then it progresses posteriorly in both jaws. So 6 months postnatally, this is the picture that you can see. And you can see over here, the tooth hasn't erupted yet, so it is still covered by the oral epithelium. This here in yellow is representing the enamel, which is covering the crown. And beneath that, this is the dentine forming the bulk of the tooth. And then comes your dental pulp, which contains the blood vessels. And surrounding that is your periodontium and your alveolar bone. 18 months postnatally, when the tooth has erupted, you can see the oral epithelium has disappeared and the crown of tooth is covered by the exposed enamel. And this is the cemento-enamel junction right over here at the constricted region, also known as the neck of the tooth. And this gingiva, below it, the part of the tooth is known as the root. So, which is the hardest tissue in the human body? Keep in mind, it's the enamel. It's made of the mineralized hydroxyapatite crystals, and therefore it is the hardest substance in the human body. Inner and outer enamel epithelia, they come together, as I told you, at cemento-enamel junction, the cervical loop, where they are going to form the Hertwig's epithelial root sheath. This grows into mesenchyme and initiates root formation, and that root formation is completed about 2 to 3 years after root eruption, after the tooth eruption. Neck of the tooth, as I told you, is the constricted part between the crown and root. Now let's talk about the secondary dentition. That is your permanent teeth which are going to appear. Initially, the 20 tooth buds, which give rise directly to primary teeth, you know, they consisted in each half jaw of 2 incisors, 1 canine, 2 molars. Early in the cap stage, the dental lamina superficial to each of those tooth buds, we're talking about the primary tooth buds, that extends a diverticulum to the base of the primary tooth bud, and that diverticulum is successional lamina. The successional lamina will now produce the buds of the secondary dentition, replacing the first dentition. These secondary teeth will develop similarly to the Bell stage, and then they will become arrested. It is at about 6 years of age after birth when they start to develop, and they destroy the roots of the primary teeth in the process. The buds of the permanent molars that do not have deciduous precursors arise in postnatal life as pencil-like extensions from dental lamina that burrows posteriorly from the hindmost primary tooth buds. Now, the full human dentition, which is the secondary dentition, has 32 teeth, as I told you before, each half jaw, 2 incisors, 1 canine, 2 premolars, and 3 molars. The third molars or the wisdom teeth are often, they might not even erupt or fail to develop. So here we're looking at the We are looking at the view of the jaw. We're looking at the upper jaw from below. We can see this thickened oral epithelium, which is the dental lamina, and we can see the buds of the primary or deciduous teeth, which are arising from the dental lamina. And as these buds are arising, similarly, you can see adjacent to them, the bud of the permanent tooth also makes its appearance from the successional lamina. Here again, you can see this is the primary tooth, and also you've got the developing permanent tooth. This is a cranium of a 4-year-old child, and bone has been removed from this here mandible and as well as the maxilla over here to show us the relationship of the developing permanent teeth with the milk or baby teeth. So if you look at the facial skeleton of a newborn, we'll see there is a small appearance of the face, and this is because of their underdeveloped nasal cavities, maxillary sinuses, and upper and lower jaws, and their unerupted deciduous teeth. So here is a comparison of the adult cranium with the cranium of a fetus. And the fetus has been projected to the vertical height of the cranium of the adult. So the parameter that is taken is a vertical line which is drawn from the lower margin of the orbit to the lower border of the mandible. In case of an adult cranium, you can see that this line is about 3 times the diameter of this orbit. Whereas in case of a fetal cranium, this line would be about the same vertical length or distance as the diameter of the orbit. So that is why the appearance of this face of a child is very different from that of an adult. You can see the underdeveloped jaws and the unerupted teeth. Now, let's come to a few MCQs. Ectodermal cells in the teeth are responsible for the formation of enamel. I told you ectoderm is the embryonic tissue which gives rise to the enamel of our teeth. Now, in cat stage of tooth development, the regulating factor for cusp formation, that regulating factor, remember, is in the enamel knot. This is an area of concentrated ameloblast present within the inner enamel epithelium. Differentiation of ameloblasts from the internal enamel epithelium takes place in which of the following stages of tooth development? Well, it is the early Bell stage in which the differentiation of ameloblasts is going to occur. You should also know about neonatal teeth. Although this is quite rare, but a baby might be born with a tooth. And this is known as the natal tooth, which is observed about 1 in 2,000 neonates. Sometimes the tooth might be erupted within the first 4 weeks after birth, known as the neonatal tooth. Now, this is an anomaly often transmitted as autosomal dominant trait. Only the crowns of such teeth are calcified and their roots are usually loose. But they might produce problems during breastfeeding, and also the neonate's tongue may be lacerated because of the neonatal tooth, or the tooth might, as I told you, its root is loose, so it might detach and cause aspiration. For these reasons, the natal teeth are usually extracted. And because they're prematurely erupting decidual teeth, spacers may be required to prevent overcrowding of the other teeth. Another anomaly during tooth development which can take place is defective enamel formation. This can cause pits and fissures in the enamel of the teeth. Now, these defects result from temporary disturbances of enamel formation, in which various factors might be the culprit, like some nutritional deficiency, tetracycline therapy, infectious diseases such as measles. So what they do is that they might injure the ameloblasts, which are the enamel builders. So over here, we can see that this is a tetracycline stained tooth, and this is showing you also gemination, that is the double teeth. Rickets, which is a deficiency of vitamin D, can also disturb the enamel formation. Here you can see the teeth which are, you can see the malformation of enamel in this condition, which is known as amelogenesis imperfecta. So you can see the pits and fissures in enamel. Also, there might be some anomalies in tooth formation related to their morphology, a condition known as enamel pearl, in which this here is a spherical mass of enamel on the root of the tooth, separate from the enamel which is on the crown of the tooth. This is caused by an aberrant group of ameloblasts. There might be fusion of the teeth. For example, over here, you can see the fused permanent lateral and central incisors. The tooth might be abnormally small, which is known as microdont. You can see over here, or it might be abnormally large, which is a macrodont. Sometimes the teeth might have extra roots. Over here in diagram B, you can see a mandibular molar having an extra root, and in C, you can see a mandibular canine with an extra root. So when there are extra roots, they will provide a challenge during root canal treatments. Similarly, an accessory root might also be present as shown over here in the case of a maxillary lateral incisor. Supernumerary teeth. Other than the variations in the morphology of the teeth, there might be variations in the number of teeth. So if their number is more than normal, it is known as the supernumerary teeth or the mesiodens. Hyperdontia, that is the increased number of teeth. This occurs in 0.2 to 0.9% of the population in case of primary teeth, but the frequency is increased to 1 to 4% for the secondary or permanent teeth. Supernumerary teeth usually develop in the area of the maxillary incisors, and they can disrupt the position and eruption of normal teeth. But usually it is asymptomatic. So here you can see the X-ray in which M is for the mesiodens, the supernumerary tooth which has appeared. So here's a scenario, a clinically based scenario, and which over here, a 20-year-old man falls down. So here is a clinical scenario in which a 20-year-old man falls down and chips the incisor edge of his maxillary central incisor, reducing the length of the crown. A dentist informs him that the tooth may erupt a little to compensate for the loss. This tooth movement is likely to result in increase in size of which of the following dental tissues? Now, the correct answer to this MCQ is A, cementum. So cementum is the tissue which is going to compensate for the loss of the tooth. Now here's another one. During an illness for a child, tooth calcification is disturbed. This will most likely affect teeth that are in which of the following stages? Tooth calcification. This is going to occur in the late Bell stage, so D is the answer for this MCQ. Accessory canals result from a break in her twig's root sheath. So if this portion is going to break, then accessory canals can form. A supernumerary tooth results from deviation during initiation. So A is the answer for the supernumerary tooth deviation. Now, the outer and inner enamel epithelia are first seen in the following stage of tooth development. Keep in mind, this is the gap stage. So it is the gap stage in which the outer and enamel epithelia make their appearance. C is the answer for this MCQ. So Anatomy Mentor is my YouTube channel. Don't forget to like and subscribe to my channel for other lectures related to not just embryology, but also neuroanatomy, gross anatomy, and histology. And also don't forget to hit that bell icons for the updates. And this topic, this lecture was prepared from Larson's Medical Embryology and also the Developing Human. So thank you. And next time I'll be coming back with another topic for the students to help them study the topic with the essential details and also be ready for their exams. Thank you. Take care. Stay blessed.